And so right now, although we have a vision, our immediate vision is this pandemic, and how can we
Right.
avoid anybody for unnecessarily reaching that hospital, because we know they're 4 times more likely. The other important thing I do want to bring up is, as our team is, we are very innovative, we are proactive, and we are making sure that we keep in all the updates as possible in seeing how and when a new COVID vaccine is distributed. And let's not forget, and I will play a major role in this, is that every individual that is in a dialysis center, every individual who in Texas is going through chronic kidney disease are regarded as those uh, individuals within that high risk category, and would be provided the prioritization of getting that vaccine. And so our immediate goal, although we have that vision, has changed to what we need to do right now to ensure that we can uh, protect all the patients and all the individuals going through kidney disease within the state of Texas.
So, how how do you view what's happening right now? Because we see those numbers rising in the general population in the state of Texas.
Well, are we surprised to see that? I am not surprised as a public health official. I mean, let's kind of look at it, and let's look at. I don't want to go too much in the medical terminology here, but an incubation period for this disease is 14 days. Meaning, if you were exposed, it'll take your body about 10 to 14 days to show your symptoms, show that you're positive. So let's look at all these rallies and all these gatherings that have occurred over the past month or two, maybe.
Right.
And so what we've seen right now is not something that has happened today or yesterday or last week. It is what had happened in 2 months ago that we are now seeing now. So is this common to us experts? No, it's not. Every one of these cases that are above and beyond what we've seen would have been prevented if none of these major rallies and gatherings occurred, because those are the influx of these new cases that are just surging in this country. Let's take a very good example in South Dakota. They had, these the biker rallies there. South Dakota's numbers within that 2 weeks surged to numbers they never ever saw before. And so this is very clear. We are not seeing something that we were not expecting. It's all to do with the timing.
Recently, we've seen people holding rallies, large rallies, in protest of the election. And every time you see those rallies, the people are maskless. They're not wearing masks. Many of them are not. And many of them are not social distancing. You don't see much social distancing happening. So with what you just said about us seeing right now what the effects of large gatherings from 2 months ago, I'll challenge you to remember those large gatherings 2 months ago, people were masked. These gatherings, it's at some of those. These gatherings that we're seeing right now, nobody's wearing any masks. Like, the majority of them are not. So what are we going to see 2 months from now based on these gatherings that we're seeing today?
Well, definitely you bring up very important points, but I really don't want to go too far, because I will tell you what, with the new administration coming in, elect President Biden has already identified his COVID task force. And
I saw
every
that.
individual in that task force is an expert.
Yes.
They're all science-driven individuals.
We have to follow the science.
And they're going to make, not going to, they're already making plans and decisions. What is science-based? And when you look at science-based of what we have seen over the past 8 months, and we bring that into the picture moving forward, I strongly feel that although we shouldn't get our guards off, there
Right.
is going to be a clear mitigation of cases just because of the scientists making policies and decisions on how to move forward with COVID-19.
Oh, I share your hopefulness about that, because the way to stop something like this is the science. We have to follow what the experts say. And once there is a clear message, one clear message from the experts being delivered to us from the experts and from the leadership, everybody's on the same accord. It should make a huge difference for our country and for each individual state. To have directives will make a huge difference for everyone.
Yep. I mean, I'm not saying it's going to be easy. Let's not even think of that.
No,
it's
no,
going
no.
to be a monumental task. But that task is going to be something that's going to be productive.
Mm-hmm.
And so what we have gone through for 8 months is going to subside because of just going towards evidence-based information and evidence-based policies that are going to be put in place.
When you look at how the disease has moved through our population, like how has it, everyone talks about it being an RNA virus. Can you explain to our listeners, like, what that means in terms of mutation and change of the disease from person to person?
Yeah, so many viruses are RNA. That's actually its genetic makeup. In another word we can use is, instead of genetic makeup, it's its nucleic acid makeup that makes that virus. And a RNA means it's a single-stranded, and I'm not going to go into too much biology, but it's a single-stranded, and then a DNA is a double-stranded. So what the virus does, it attaches to a membrane, a receptor that we have, and then the genetic material of the virus is gone. It transfers into our cells, and then the virus uses our cell mechanism to change that RNA into DNA, and then it starts using our system to multiply, and that's where we call it incubation period. And so when it starts multiplying initially, for the first 5 days, and normally we would tell individuals, why don't you if you feel you were exposed, get tested between 5 and 7 days. And we use that 5 days is, even if you were infected today, it takes your body about that 5 days to develop enough virus for a test to detect, because of the sensitivity of the test. So by 5 days, your system will develop enough so-called viral load to ensure that it can pick up that by a test. And so that's how these viruses work. From RNA, they use our system to make that RNA into a DNA, and from DNA it starts replicating and makes multiple copies of itself.
So how many strains of COVID-19 do you all estimate are in our population?
That's a very difficult question to answer when I'm not I haven't kept up with the strains, but there has been numerous strains that have been circulating. That's very clear when we do what's called a DNA diagnostic test regarding this strains.
Dr. Mangla, can you tell our audience a little bit about how you ended up on dialysis? I just want to switch gears so they understand what your connection is to kidney disease.
Yeah, so I'm not going to go in details, but I grew up in South Africa, and I had injured my kidney as a teenager. And again, we are bringing up and we're talking a lot about education, right? And we just I neglected it and just continued with my life, and not knowing much as time went by. My one of my kidneys started deteriorating significantly. If I had known, or if I had the education, or if there was literature in promoting education of chronic kidney disease, I could have saved my kidneys uh, just by changing my lifestyle, changing my diet. I think that is the crucial part. And making sure that I was monitored with my creatinine levels and my bun levels and my GFR levels on a continuous basis. But none of that happened. And when it got to a point where it was too late, and we all go through that. If you ask anybody in dialysis, it was too late. And so my goal for the community or for this organization moving forward is I do not want anybody to say it was too late. Because of going through 8 years of dialysis was not easy, but I did it.